Okay, let's learn about the single biggest piece of health legislation in the past several decades, the Affordable Care Act. Let's go over the basics of it, what led up to it, why it was a big deal when it passed, how it was implemented, how it has impacted uh, individuals and patients and employers and the health insurance and the healthcare industry. And then we'll assess its strengths and weaknesses, what's worked and what hasn't worked. So I hope you all are doing well. Gonna focus here on the PowerPoint and let's go on. It, it, the more you learn about Obamacare, the first thing I think you'll conclude is it's truly amazing that it's still here in 2020 and that it even passed at all. Because the more you learn about the details of it, it's extraordinary. It barely passed. It has faced new elections, three Supreme Court challenges now. I almost lose track of how many times this act has gone before the Supreme Court, but I think we're on at least the third. And it has managed to just eke out a survival that you have to, whether or not you like the act, and there's things about it that are impressive. There's things about it that are regardless of what your overall opinion is. I think most people's overall opinion of the ACA is that it's okay. Now, if you're someone who's picked up insurance who didn't have it, or you picked up Medicaid insurance, then your opinion is really positive. It's probably been a huge game changer for you. If you've just seen your premiums and deductibles goes up and you didn't get anything new, then you're probably ambivalent to opposed to this thing. For all that aside, it is truly amazing that we still have the ACA with us. And whenever I give talks on the ACA, I always make it really clear that I have no financial interest in this and that my politics tend to be I'm a Democrat sort of emotionally, and financially I'm a Republican. So I always have this conflict of, I broadly support things like Obamacare, and I broadly support big programs that sort of invest in human capital and contribute to a bigger middle class. No question. I'm a New Deal Democrat, but I'm an Eisenhower Republican in terms of let's make sure we pay for it. And I don't like paying more taxes than I have to. I think that's not all that odd. I think people have this conflict in their opinion of public policy. Most people do. Here's the interesting thing about Obamacare, the ACA. Its origin, like the idea for the structure of Obamacare, comes from the Heritage Foundation. And the Heritage Foundation, for those who don't know, is a very conservative, Republican supporting, free market embracing think tank in Washington, D.C., that's been there for many, many, many decades. It was one of the original founding think tanks that really supports conservative capitalism, Republicans. It's, that's its strength. And back in 1989, they came out with a critical issues volume on what they think a Republican conservative free market capitalist healthcare reform proposal would look like. And if you ever have the chance to read it, I just cut and paste some of the key parts from the summary. It's basically Obamacare. It just says, we're going to model health insurance on car insurance, which is everybody has to have it, but it's going to be private insurance. Under the Heritage Plan, there would be a requirement. You got to have health insurance. The easiest way to monitor this new individual requirement would be for them to show it on their tax returns. That's how Obamacare has worked up until recently. And if a family didn't have proof of it, then they'd have to pay a fine. That's Obamacare. And the last part is a Medicaid expansion, because some people they don't earn enough to submit a tax return. And the Heritage Foundation said for this group, we'll expand Medicaid. That is, in a very distilled essence, that is what Obamacare is. It's an individual mandate that gets you to close to universal coverage with Medicaid expansion for those who need that. This was put out in 1989. In 2006, Republican Governor Mitch Romney passed it in Massachusetts with Democrat support. So it was a bipartisan implementation of the Heritage Plan. It was piloted then in Massachusetts. And lo and behold, Massachusetts, for a variety of reasons, not because of this, this just helps. But Massachusetts is overall one of the healthiest states based on smoking, obesity, physical activity, drug deaths, all of that. And they also have the lowest uninsured rate in the country, about 2%. you should click on this though. All of this is true, and yet trying to explain this to people and having things like the Affordable Care Act, also known as Obamacare, causes a lot of confusion. This is a funny clip, famous clip in Jimmy Kimmel's show, where he went out on Hollywood Boulevard and said, "Which one do you prefer, the Affordable Care Act or Obamacare?" It's a trick question, and you should just click on it and watch people's reactions. And their answer is really a function of, do they like Obama or not? And those who like Obama, they like Obamacare more than the Affordable Care Act. Those who don't support Obama and don't support the Democrats, they prefer the Affordable Care Act. It's the same thing. Now, the decision that Obama made was, you could go the Clinton way of reforming healthcare, like he tried in 1993 and 1994, and then the likelihood of that passing goes down. Or you can take a more pragmatic approach, which is you change less, you achieve less, but you also have a higher chance of actually passing whatever you want to propose. And clearly, Obama said that's the lesson to follow, which is, in some other perfect world that doesn't exist, the United States takes 2 or 3 years and rebuilds its system to be like Taiwan's or Singapore's or France's or Australia's, and it redoes its entire system from top to bottom, and it gains all these efficiencies and we cover people. But guess what? That's not likely to happen. In fact, it's almost impossible. So Obama looked around and had his advisors look around and talked with Democratic leaders in Congress and said, let's find something that's more pragmatic. And so I always put the slide in. This is the picture of the Clinton healthcare reform plan being signed into law. Never happened because it was too ambitious. And this is the picture, conversely, of Obama signing the Affordable Care Act into law. And there's Kid President and Nancy Pelosi and Joe Biden. And Nancy looks probably the happiest person in the room. Joe Biden still working on the social distancing. But this was a really big day, March of 2010, March 23rd. Literally the day after it's passed, Ken Cuccinelli, Attorney General of Virginia, files the first of many lawsuits challenging the constitutionality of the Affordable Care Act. Is it constitutional to require people to have health insurance? And it really becomes just the Republicans' efforts to overdo and undo and throw out the Affordable Care Act, even though it passed democratically. This becomes an obsession for the next 10 years by Republicans to repeal and replace or just repeal Obamacare. And that's Ken Cuccinelli, and he's a super, super charming person you can read more about. Now, first near-death experience. That loss. So this whole effort to call into question the constitutionality of Obamacare winds its way through all the different courts. Some courts say yes, it's constitutional. Some say no, it's not. And when you have disagreement in the courts, eventually it ends up at the Supreme Court. In the spring of 2012, 3 days of oral arguments before the Supreme Court justices saying it is, it isn't. And then finally on June 28, 2012, the decision comes down from the Supreme Court. You can click on this really funny first 15 minutes because CNN and Fox News got the result all wrong and then had to backtrack. It's just for comedic value. It's a lot. The decision was by a very narrow vote, 5-4, that yes, Obamacare is constitutional. But no, you can't force all the states to expand Medicaid to cover more people. States have to make that decision on their own because that's a tenet of federalism. So wow, one single vote by the Chief Justice John Roberts saves Obamacare. And then, a few months later, the next near-death experience is where Obama was reelected. They had Mitt Romney won. It's not clear that Obamacare would have stayed in its current form. What is Obamacare? Let's just distill it all the way down to its most basic things. Number one, and this is, by the way, the first part of Obamacare is popular with I would say, most Republicans. It's insurance market reforms. It says you can't exclude people who have pre-existing conditions. You can't charge sick people more. You can't charge women more. There have to be limits on out-of-pocket expenses. This is the most, for college students. Hello, college students. I'm not going to tell you what your opinion of Obamacare should be, but I'm going to tell you what your opinion of this part of Obamacare should be. That allowing children to remain on their parents' health plan until they're 26 should be wildly popular. And by the way, it is, because that's an awesome part of Obamacare. That it's one less thing in your 20s to have to worry about when you're changing jobs and going to grad school and going through changes. That's one less thing to worry about. Obamacare also puts caps on lifetime or annual coverages. It eliminates. It says that insurance companies can never say, okay, we're done covering you. You hit $1 million this year or in a lifetime. So it eliminates coverage caps, and it requires that insurance companies pay out 85% of their premiums to medical providers. In other words, it puts a 15% profit cap on insurance companies. If they make more than 15% profit margin, they have to return that extra in rebate checks to those who pay the premiums. It establishes an employer mandate for employers that have over 50 workers. They have to have insurance or pay a penalty. This is not super popular, and it was postponed for a long time. But it's there, and it's probably it's not the most unpopular, but it's not the most popular part of Obamacare. A good part of Obamacare, number 3, is it creates all these web pages that you can go on and buy insurance. And it sounds crazy that it took till Obamacare to have online options to purchase health insurance. But before that, it didn't exist. Now, the launch of it was terrible. In the fall of 2013, the website glitched and was overwhelmed and just could not handle the traffic. But they fixed it within about 6 months. It works really, really well. In fact, it works too well. If you ever go on there and kind of put in some information just to kind of start shopping, you'll get deluged by phone calls and emails from insurance companies trying to sell you health insurance. Point number 4, by far the most unpopular, and in the last 2 years, it was repealed. The thing that makes Obamacare sort of hold together is that if you're going to give out new benefits and if you're going to cover more people, then you've got to have an individual mandate, which means that you have to have other people who have been skipping health insurance. You have to have them buy insurance. It has to be a requirement because you got to get the healthy people into these risk pools to offset the sick people in the risk pools. And if you let them just skip insurance, as we have for many, for all the modern era, then insurance doesn't work if you only buy it when you're sick. The way insurance works for your house, for your car, for any property, for healthcare is everybody has to be in with their premiums so you can keep it affordable and cover those who are sick every year. Now, that was there. It was unpopular. This is the thing that spurred the Supreme Court case. It was essentially repealed in December of 2017 in the tax cut of that year when they just got rid of the penalty. So now if you don't have insurance, there's no penalty. And that's how this worked. You either bought insurance or you paid a penalty. And that financial penalty helped fund the insurance risk pools. The last thing that Obama had that was first mandatory before the Supreme Court case, but then became optional, was Medicaid expansion to cover more people through Medicaid. And that's actually been probably the part of the program that has had the biggest positive impact in terms of coverage. Now, doctors aren't wild about Medicaid because it's a lot of bureaucracy and they don't get paid well, but hospitals need it to help offset their losses. And if you're uncovered in a state that makes it really hard to get Medicaid coverage, and Virginia used to be one, a lot of states in the South, if you don't have a child, you can't hardly get covered unless your income is just so ridiculous. But that's a big part of how Obamacare has expanded coverage is through Medicaid expansion. And this is another triangle. You guys are going to see another triangle. Medicine's triangle of conflicting expectations. The way we're all wired is that patients want everything today with no copay and no wait, right? But you can't give patients absolutely everything because you can't, because there's just limits. What do clinicians want? They want to be paid well, be left alone. They want new science and technology. They want to run their own affairs, and they don't want to be bothered. And if you just give them everything that they want with no checks or balances, that doesn't serve the entire system well. And what do insurers and government policymakers want? Well, they want a good return on the money they spend. Government wants to cover everybody. They want reasonable costs. They want access, and they want healthcare that works. So an example of, what do individuals want? Well, they want to stay on their parents' plan till they're 26, and they don't want to have any pre-existing exclusions from getting insurance. Great. That's a wonderful thing. But you can't just get a great thing without paying for it or covering it. And that's so the individual mandate imposed by the government helps finance these new benefits. And these new benefits means that clinicians have more patients who are insured, which means they get paid and hospitals get paid. And so it's in their interest for doctors and hospitals and nurses to have more people covered, because more people covered means more people that can get access, and the government wants that too, but they want to pay for it. They need to pay for it. It goes into effect in 2013, and the percentage of the population that's uninsured goes down. It's been creeping back up for a number of reasons. Now it's going to be going up bigger with COVID-19, but it's had a big impact. And the number of children who are uninsured continue to go down under Obamacare, down to like 5%. And there's that big drop off when Obamacare comes into effect. About 20 million people, 20 million Americans pick up coverage in the year since it went into effect. And although it's not equally helpful for all races, um, the reality is that everybody's improved somewhat under Obamacare, and the uninsured rates have come down for all groups. It's also, in its own way, slowed the rate of Medicare cost growth. Um, that's total Medicare expenditures from before Obamacare to after. It slowed the rate because part of Obamacare was not as big increases every year in what they paid hospitals as they used to. They still pay them more every year, but just not as much more. And that slowing of Medicare cost growth was intended to pay for some of the expansion in coverage. So that's all pretty good, pretty good. What has Obamacare not done? What it can't what can it not do? There are many low-income people that, even with the support of subsidies, still can't afford health insurance. They work part-time jobs. They make X amount of money that makes it so they can't qualify for Medicaid, but they don't make enough to buy private health insurance. They have other needs first: housing and utilities and food. And health insurance is issue number 5 or 6 in their lives, and even with subsidies, they can't cover it. Another problem is that some states have really good, robust competition between insurers that holds down annual increases in costs. Some states have none, and their annual increases in individual health insurance policies is just skyrocketing. And there really isn't anything in Obamacare that holds them back. There's not a big cost control mechanism that limits increases in health insurance costs or in prices. And that's in the article that you guys read. That's the biggest flaw of the ACA is the cost control and the deductibles. Deductibles are what individuals have to pay out of their own pocket before the insurance kicks in. And individual deductibles can go as high as $8,000, and for families it can be as high as $16,000. So that's what you have to pay out of your pocket for healthcare. And then once you hit 16,000 or 8,000 for an individual, then your insurance kicks in. Well, my goodness, that can feel like you don't have insurance at all. That's so expensive. And even they had acknowledged, those who worked on it said that was a mistake. And that's the deductible problem. Is just the overall, it's symptomatic of the fact that the ACA really didn't do anything about costs. And that's also in the 60 Minutes clip you watched about. It's a fair criticism. I think if it had had robust cost control in it, it wouldn't have passed, because it only passed by a handful of votes, like 4 votes, 5 votes in the House, and the tie-breaking vote in the Senate. So there was no margin for error, and there was no room for adding, more difficult things to the Obamacare. There's still 30 some odd million people that are uninsured. So Obamacare didn't solve that either. And what's the last thing I would focus on? In the South is where you see not all, but most of the states that didn't expand Medicaid. And interestingly, that's the part of the country where you have the highest proportion of uninsured people. That's also in the Midwest. But this is the bulk of where states have not expanded Medicaid. There's nothing Obamacare can do about that. That's a decision by the Supreme Court to make that voluntary. But there's tens of millions of people in these states, Texas and Florida alone. If Texas and Florida expanded Medicaid like all the rest of the states, there'd be 5 million less people uninsured. And there's a lot of red states that, like you take Arkansas, Louisiana, Kentucky, West Virginia. These are, generally speaking, red states. Indiana, Utah. These are places that vote Republican, but they've also expanded Medicaid. And the governors of those states and the senators of those states are saying to the Trump administration, please don't repeal Obamacare. This helps our state. So there's John Kasich of Ohio, Rick Snyder of Michigan, both Republicans. Republican governors of states that have voted Republican, saying to a Republican president, please don't veto and don't repeal Obamacare, because it covers a lot of people in our state. It's also interesting to note that some of those states that are in the South, I'll just give you an example: Kentucky, New Mexico, West Virginia. they are the winners of the tax system in the United States because the wealthier states, New York, Massachusetts, New Jersey, and Connecticut, they pay X amount. The people in these states pay a lot of taxes. I'm sure people who are listening to this and live there say amen. These are high tax states, high state taxes, and also a lot of people there who pay their federal taxes. And a lot of their federal taxes end up going to these states, the Kentuckys, New Mexico, West Virginias, the southern states. And it's just so it's ironic that these states are already being, in a sense, subsidized. These red states, Republican-leaning states, are subsidized by, generally speaking, blue-leaning, more affluent states. And they're that they're so hostile to things like Obamacare and the government, and that they hate government support. Well, they're already living off of tax support from the wealthier blue states. The proportion of taxes that these states get back is not, they pay more out than they get back. It's not a one-to-one ratio. And some of that extra that they don't get back goes to the poorer states. Just sort of wrap up, it's just all of these dots represent one of the 3,000 US counties. And the bigger the dot, the bigger the population in that county. So if you break it out by how healthy are the people in that county, and the closer you are to 70, the healthier you are, the less obesity, the less diabetes, the longer your life expectancy, then you're down here. As you work your way back down the x-axis to that unhealthy level, what you see is that the healthier states have tended to vote more for, they did at least back in 2016, they voted for Democrats and for Hillary Clinton. It's the Midwest and Southern, especially Midwest counties, that are really struggling with their health. These are places where the opioid problem can be really exacerbated. But just in general, the sicker and less healthy the county, the more likely they were to vote for Trump. So this is just an interesting take on how healthcare impacts politics, and of course politics impacts healthcare. But you can look at this and see that some people in some counties end up voting for Trump in part because life is not going well in those counties. Health is not good. The economic situation is not good, but it impacts politics. Still not resolved from Obamacare is the question: is healthcare a right? Because you can have the right to free speech. I have the right to free speech, but my right to free speech doesn't really cost you anything. I can just get on Twitter, Facebook. I can write an article on my blog. I can say the United States should have a national healthcare plan. Great, no problem. That's my right. But if you say someone has right to health care, that means somebody over there has to pay for it. Someone else has to provide it. Someone else has to finance it, organize it, deliver it. So not all rights are free in the sense that, you know, again, a right for me to trying to think of another right, just like the right of freedom of religion. I can go worship, do whatever I want. It doesn't cost anyone else anything. It's my choice. But some rights, to say that you have a right to education, K through 12, that requires taxation. To say that you have a right to a lawyer, yep, you do, but someone then has to pay for that. That requires someone else to spend money to fulfill your right. And that's why healthcare has been trickier. It's easy to say healthcare is a right, and it probably is in some ways, but it's the kind of right that comes with a price tag. Someone is going to have to pay to fulfill that right for those who can't pay for it themselves, and that's why it's trickier. Now, it is tricky, but every other country that's wealthy and developed has said, yep, we think it's a right. All right, so the Obama administration winds down, and Trump is running for office, and he says, we will immediately repeal and replace Obamacare. Nobody can do that like me. We will save money and have much better health care. As you can imagine, we'll cover this tomorrow. That hasn't really played out that way, but it was interesting to think, or to know, that at one point he actually thought that. At the end of this class, I always ask people, raise your hands if you think more people should be covered, that we should cover everybody. And I will tell you, most classes, most of the time, people say, yep, I think everybody should be covered. And even the people who probably are ambivalent will probably just be quiet, because the socially acceptable thing is to say, yes, everybody should be covered. It's like the humanitarian thing to think. I think that. But again, if you're going to expand coverage to 30 million people, if you're going to get more people covered, that's going to cost money. And you've got to come up with an extra source of revenue. So I always ask, what taxes would you guys be willing to raise? And they always come up with interesting with sales tax, sin tax, travel tax. Wouldn't get much money from that right now. Value added tax is like another sales tax. Property taxes, wow, I think some people think they're paying plenty of that. Capital gains tax, inheritance tax, payroll tax, all these different taxes. It's interesting. The one that ends up being the most popular once you put them all on the board is a quote unquote sin tax. I don't think it's necessarily a sin, but just if you have a gun and ammunition, you're going to pay a tax and all that. And it's one of the ones that actually people are like, I can live with that. Okay, guys, that's Obamacare in a nutshell. We will now, tomorrow, kind of cover quote unquote Trump care because a lot has happened since Trump took office. All right, so I will see you all tomorrow. We'll do Trump care. Take care. Stay safe.
You have stopped screen share.